Hey guys, it's Dr. Krad. Today I'm going to be doing surgery for James's mom. And we're just doing it with topical anesthetic, no sedation, just topical anesthetic so she doesn't feel discomfort. But part of the anesthesia is just some love because he's here to hold her hand. And so we're going to make sure the patient's very comfortable as we do this. This patient is not receiving any sedation for cataract surgery. No oral anesthesia, no IV anesthesia, only numbing drops. She is comforted by having her loving son present for support. The patient received numbing drops, and here I'm irrigating the eye with some extra numbing solution. If someone is very anxious prior to surgery, which is common, we always offer sedation so long as there are no health concerns with it. After instilling the anterior chamber with viscoelastic, I create a triplanar temporal incision with a 2.4 millimeter keratome. You'll notice some capsular folds as I perform the capsulorhexis. That's just a sign of zonulopathy, some weak zonules, but there's no shifting or movement of the cataract, so there's no phacodenesis. So I'm not really worried about this case. I'm just going carefully so I make sure I don't induce any more zonular loss. A good hydrodissection will decouple the cataract from the lens capsule and zonules, so less force will be transferred to the zonules if you have a really good hydrodissection. So I just want to make sure I do that and the lens spins freely. Next I will introduce the phaco needle in the eye and then create a trench and then break the cataract in half. I just create a groove and then I will push with my second instrument and crack the lens. It's separating very easily. This is a medium density cataract, not too dense and not too soft, so it comes out very easily. Protecting the cornea as I remove each nuclear piece. So far this is proving to be a routine case and the cataract is coming out very easily. The patient is very comfortable. We keep checking on her to make sure that she's not having any discomfort. During this case, I'm talking to the patient's son to make sure that he's aware of what we're doing. Prior to the surgery, I did talk with the son to make sure that he has the stomach to watch a procedure like this and that he has the mental fortitude to be calm and relaxed during the case. And I don't bring patient family members back routinely. Every once in a while, I'll make an exception. And in this case, the patient could not get any sedation. And so I felt that it would comfort her to have a family member with her. And I felt confident to do the case with the patient's family member present. And here I'll show you what it was like to be in the operating room. So now, as I go in here, this is a polisher. I'm gonna go under and just swipe. Look at all the stuff that came out.
Yes.
See that?
Come off right off.
It doesn't, because it doesn't really affect vision, but I just
Right.
like it clean. I just like it clean.
Oh, that's still plenty though.
Yeah, it's just in the side, so it doesn't really affect vision,
Mm-hmm.
because it's really the center that affects vision.
Yeah.
So check. Do you have you want to record this? This is the part to record.
Yeah, absolutely.
So
That's totally fine.
yeah. So go on that. So as you can see, the patient's son was comfortable. I was very comfortable, and most importantly, the patient was comfortable. Watch this. So here, this right here. You're gonna see this is a lens implant. It's folded like a taco.
Uh-huh.
And it's gonna come in the eye. It's going to unfold. Alright, so now I'm going to put it in the capsule bag and it's in. So now I just have to clean out the rest of this stuff. See?
Oh, perfect.
So I'm going to remove the filler, and this rest of this stuff. It's all coming out now. That's just an air bubble. People ask, what's the black dot? Those are air bubbles. So I'm just removing all the gel, returning the eye to its natural state. Right? After I remove the gel, I'm going to seal my incisions. BSS. So we do it sutureless, no stitches. So I'm just going to hydrate.
Dr. Krad's making it happen.
Hydrating the incisions. When I do this, it'll seal.
Excellent.
So now I'm going to test, is it watertight or not? So I take a wet cell and I check the pressure. I'm going to make sure the pressure is good. So the pressure is, I'm going to set it at an even better level. Okay, now the pressure is normal. So if I dry this incision, no water is coming out. And if I tap the eye, no water is coming out of the incision.
Perfect.
So it's watertight. And so now I'm just going to put some antibiotic. Here's some antibiotic. And alhamdulillah, salamtik.
Good.
Those are floaters. See the black
Thank
dots?
you.
Look at the floaters.
Uh-huh.
See those black dots?
Yeah.
When she moves her eyes?
Yeah.
قلل الدم على الضوء. See those move around?
Yep.
Those are floaters.
Yep.
They're behind. So that's what people, they're like, will my floaters go away? No, they don't go away. They're just in the back there. But alhamdulillah, everything went perfectly.
Alhamdulillah, salama, kul shay tamam.
All right, so we just finished the surgery for James's mom. What did you think?
Oh, it was excellent. Excellent job. He explained everything step by step, made it so easy, and it looks easy, but I'm pretty sure it's pretty hard. He makes it
We're
look
trying
so
to
easy.
make it easy. That's our goal. Did you learn a lot?
Of course.
Yeah,
yes.
so now you know what a cataract surgery is like.
Yes.
Cataract surgery usually takes about 10 minutes or so. We make sure the patient has no pain, and we give some local anesthetic so you don't feel any pain in the eye. And if you want, you can get some sedation in your body just to be relaxed. But yeah, 99.5% of them, they go really easy like this.
Yeah. It seemed really simple. He makes it look simple, but it's obviously, it takes a lot of practice. And Mr. Krad made it look great, and he did an excellent job. So thank you. We appreciate it.
All right.
Thank you.
Bye, guys. Fortunately, the patient was seeing 20/20 without glasses the week after surgery. As always, thank you so much for watching. I'll catch you on the next one. Peace.